Low desire is probably the most difficult problem to treat because it has so many factors. Like, women often think, oh, well, it's just menopause hormones, or my testosterone is low. But look at all these things that go on when you're going through cancer treatment that can affect your desire. Sex may be painful, you're stressed out, you may be depressed, you may have chronic fatigue or nausea or diarrhea. Unfortunately, going through an illness can highlight a lot of relationship issues if there's not good communication or you don't feel supported by your partner. You may feel bad about how you look, so body image issues. You may feel like you're no longer feel sexual, or your body feels like it's been medicalized by your cancer treatment. And we all know that women in cancer, and I heard someone mention it in the last session in a question, often get on many medications, including antidepressants and anti-anxiety drugs, which both damp down your sexual desire typically, and opioid pain medication, which is an absolute enemy of sexual desire. So can you get better desire through chemistry? That would be nice. And the FDA did approve 2 drugs in the last few years for women's sexual desire. One is a pill called flibanserin, or Addy, A-D-D-Y-I, that you have to take daily. And another is an injection of a hormone, bremelanotide, which is called Vyleesi. They managed to get these drugs approved by whining a lot. I'm sorry, but the drug manufacturers went to the FDA and said, there are all these drugs for men's sex lives and we have nothing for women, and you darn well better approve these drugs. But you look at the clinical trials and these drugs are basically barely better than a sugar pill. So they managed to get them approved, but they don't work all that well, and they have a lot of side effects like nausea and headaches, and they're disappointing. Also, there's no testosterone dose or way of administering that's approved for women, and again, why? Because the clinical trials didn't show anything. But a lot of women take testosterone, and maybe about half of women say they do get some boost in desire from it. But also testosterone gets converted to estrogen in the body, and nobody knows if that's a lot safer. We think it's safer than taking estrogen, but so unfortunately there's no magic answer. So what can you do to increase desire? Think about what sparked your desire before your cancer. Maybe it was playing tennis or dancing or having intimate talks or cuddling or romantic evenings with your partner, or reading or listening to erotic stories, or self-touch. Improving sexual communication and pleasure is important. Treating pain and minimizing relationship conflict and depression, and working with your doctor on changing any medications that might be interfering with your desire. When you go through cancer, it often gets you into a caregiver relationship with your partner rather than feeling like a lover, and then it's hard to switch back. And that can be a challenge. And also, many partners don't initiate sex because they're afraid that they're burdening you or that they're going to hurt you physically. But women interpret that as, oh, he doesn't find me sexy anymore. And if you don't talk about it, that can become a real issue.